So my name is Molly Cole, and I'm the Senior Director for Health System Improvement at the Health Quality Council of Alberta. I'm a registered nurse in my background, and I have done some work in continuing care over the years. I was involved in the antipsychotic project that happened about 5 years ago in our province and still continues under the leadership of our seniors provincial team. I'd like to start us off in a good way today by acknowledging the traditional lands of the many diverse First Nations, Métis, and Inuit people whose ancestors have walked this land, known as Alberta, since time immemorial. I am calling today from the traditional territory of the Blackfoot Confederacy and the Bearpaw, Chiniki, Wesley, Blood Tribe, Piikani, Siksika, and Tsuut'ina nations, where Treaty 7 was signed, and the river-battled territory of the Otipemisiwak Métis First Nation within Alberta, on the land surrounding the confluence of the Bow and Elbow rivers where the city of Calgary is located. As a settler of Irish and British descent, I am honored to love these lands and make my commitment to reconciliation by continuing to learn about the traditional ways of those whose knowledge will enrich us all and bring healing from colonization. And finally, today, I would like to reflect on the importance of water to sustain life and our current collective efforts here in Calgary to work together to conserve this vital resource as the integrity of our water pipes are restored. And I'd also like to thank those of you who have completed either your site level evaluation report on the site level reports that were sent out in April, or the provincial report that was sent out as well. Sorry, I think the site level reports went out sooner than April. So today we want to talk about the survey itself and provide an overview of some of those results and offer some actions for improvement based on the data that has been collected. And I want to share with you some secondary analysis that was not part of the provincial report, but that HQCA analysts have done to look at what the drivers of the quality of life questions that were asked in the resident survey this past time, and also talk a little bit about the next steps. So the HQCA conducts surveys in continuing care homes, long-term care, and designated supported living, known as Type A and Type B sites, to give a voice to residents and their family members. And this is one of the ways that we fulfill our legislative obligation to engage with Albertans, to gather information and evaluate programs and disseminate findings, which is one of the objects of our legislation, the Health Quality Council of Alberta Act. And we use these surveys to help identify where there are successes and opportunities for improvement in this area of continuing care. And in July of 2023, the site level reports were shared with the facility-based continuing care owners and operators. And those reports provided detailed site-specific results that can be used at the site level for ongoing monitoring and quality improvement efforts. And this work is also to demonstrate the value of including resident and family voices in engagement with site leadership. And we see that conducting the surveys and publishing news reports on the surveys is one way to promote transparency within the healthcare system. So this time we made a few changes to the surveys, the family and the resident surveys that were sent out or that were conducted. And this was to improve our survey processes and also in response to questions that Ryan, who formerly was leading this work, had heard from you, the partners within the continuing care area. So this was the first time that we conducted the survey of residents and family in both long-term care and designated supported living at the same time, as I say, Type A and Type B homes. Previously, the DSL and the long-term care surveys were completed separately in different years. And this is also the first time that residents from long-term care were surveyed since 2008. And we did this in response to feedback from leaders in continuing care, of many of whom who who offer both services of long-term care and designated supported living in one home, so to make it more streamlined for those homes. The question period was changed to, it was shortened from 6 months to 3 months, and this allowed residents and families to provide meaningful feedback and reflect on the more recent time period, because we were still having some influence of COVID at the time that the survey was in the field. And there were a few changes made specifically to the resident survey. Um, the number of ways that residents could respond was increased from a face-to-face interview to include telephone interview and email surveys. And also we added 2 new measures, which we're quite proud of: the compassion measures and using the Sinclair Compassion Questionnaire short form, and also quality of life using the DEMCAL tool. The sites that were eligible are suggested here on the screen. So the sites were eligible if they were open for more than a year before we started data collection. And we focused on sites where the residents were primarily English speaking. Personal care homes, group homes, family care homes, or lodges, including mental health support homes, were not included. They were excluded from this round of the survey. Residents were eligible to be interviewed or to have their data collected if they were cognitively well, and we assessed this using the CPS score of less than 5. And we also did not include residents from the DSL-4D stream of the service provision. And the individual's inclusion at the site was done with the help from a site liaison person that was chosen by the site to help us figure that out. In addition, the residents who were legally blind and hard of hearing were not surveyed, and if they were unable to communicate or give verbal consent to the survey, then they were also not included this time. And the family members were chosen by the family member that was most involved with the resident's care, and it could be a family member or a friend. And the individual had to live in Alberta, and they could not be a public guardian. Interestingly, language did not appear to be an exclusion criteria for family, in that 96% of the family members reported that English was the language most spoken at home, as reported in this family experience report. So the survey was a census of all eligible family members within the sites, and we surveyed almost 300 sites where we had both family and resident surveys happening. We received responses from over 8,000 family members and over 2,000 residents. We began data collection in July of 2022, and we ended it earlier in 2023. In early 2023, the survey closed, and this was longer than usual. We had, usually we're in the field about 4 months for a survey, but for this survey round, we had challenges confirming contact information with the sites. We had some trouble establishing site liaisons to confirm those resident interviews, and we had some challenges recruiting surveyors. We had about half the number of usual surveyors that we were usually able to recruit to do this work. And some of the sites were still in outbreak at the time of this survey, so presented some challenges. So now I'm going to give you a bit of a review of the results at the provincial level. So this is a bit different than what you may have seen in your site level responses. But overall, we wanted to point out that the experience reported by residents and family about the quality of care at the continuing care sites is not consistent across Alberta. We see a wide range of variety between sites across the province, where some sites have a really high score in certain areas and other sites have a really low score in the same areas. For example, the dimension of meeting basic needs, the long-term care site family scores ranged from 50 out of 100 to 100 out of 100. And for the dimension of staffing, care belongings, and the environment, the resident scored ranged from 59 out of 100 to 97 out of 100. So even with the growing pressure on facility-based continuing care sector in recent years, we did notice that there are sites that are providing exceptional care, and the experiences rated by families and residents is very high. For instance, 26% of the sites scored over 90 out of 100 on their score for the dimension of care related to kindness and respect. And 78% of the sites scored over 90 out of 100 on their scores for meeting basic needs under the dimension of care. These numbers are similar to what we saw in past years, and there are some sites that have shown to be doing well in certain areas. But year over year, there is very little changing in the results of this resident and family survey. And the overall results have not changed drastically in the 4 years that the long-term care surveys and the 3 years that the DSL surveys have been being conducted by the HQCA. So now we're going to go over some of the numbers. The overall care rating, which is intended to reflect the respondent's overall experience at a site. You can see on average that the residents rated their overall care of experience of 7.5 in long-term care and 7.7 in DSL, and that's calculated out of 10. And for the same overall score, family members rated their overall experience on average of 8.3 in long-term care and 8.4 in designated supported living, again, out of 100. The other years, these are very similar results in the overall care rating that we have seen previously. Another important indicator of a family member and a resident's overall experience with a site is whether they would recommend the site to someone who needed the continuing care services. And the family question was, if somebody needed facility-based care, would you recommend this continuing care home to them? And the resident survey was, would you recommend this place to a family member or friend? And on this survey, the average percentage of residents who said yes, they would recommend a home was 87% and 88% for long-term care and 88% for designated supportive living. And the average percentage of family members who said yes, they would recommend the site was 93% for long-term care and DSL. So, and the individual site averages for this question range from a low of 67 to a high of 100%. So as I mentioned previously, this survey iteration had 2 new measures added, one around compassion and one around quality of life. So compassion is increasingly recognized as a key driver of patient outcomes, patient experiences of healthcare provider well-being, and reduced healthcare costs. And for this reason, we included it in our surveys. Residents were asked multiple survey questions regarding their relationships with their healthcare providers. And these questions came from a tool known as the Sinclair Compassion Questionnaire Short. They are similar to the other dimensions of care. These survey questions were combined together and summarized to a single score ranging from 1 to 5, with a higher score indicating a greater experience with compassion. We asked the question regarding quality of life in this new suite of questions that were added from the DEMCALC tool, because current thinking and literature is that quality of life is one of the most important aspects of a resident experience. And it also supports the Alberta Facility-Based Continuing Care Review and the recommendation that we establish quality of life as the #1 priority goal for Alberta's continuing care system. Provincially, for long-term care residents, the score was 69 out of 100 and 71 out of 100 in DSL for quality of life. So a dimension of care is a set of questions that I alluded to in the previous slide, where topics share a similar theme. And by grouping these questions together, we're able to do some analysis comparing these dimensions of care to the overall care rating and the propensity to recommend recommend a care home. And together, this analysis gives us an idea of the resident family members' overall experience with continuing care level at a really high level. And it helps us identify areas of success and opportunities of improvement where we need to look at specific aspects of care and services. So that's why we look at these dimensions of care. So these groups of questions are summarized on a score of 0 to 100. And generally for all respondents who answered the minimum number of questions, they can be compared then within a dimension of care. So the two categories of dimensions of care on the two surveys are listed on this screen. For the family survey, there were 4 dimensions of care with the addition of the food rating scale. And for the resident survey, there were 7. This was reduced from previous versions since new measures were added and the decision was made to change the dimensions of care based on engagement with some of our system partners. So presented here are 3 of the dimensions of care for the family survey: staffing, care belongings, and the environment, which for long-term care was rated at 76% and 78% for DSL, and kindness and respect, which was rated at 86 in long-term care and 88 in designated supportive living. And providing information and encouraging family member involvement was rated at 84% in long-term care and 83% in designated supportive living. The last 2 dimensions for the family survey are meeting basic needs, which was 91% in long-term care and 96% in designated supportive living. And you can see there's quite a wider range in long-term care for that particular dimension. And also the food rating scale, which asks family members to rate the food at the site from 0 to 10. And this was rescaled here for this presentation to be 0 out of 100 to keep it consistent with the other dimensions of care. Here are 4 of the dimensions of care for residents, and provincially, while the average scores are fairly similar across the dimensions of care, there were some aspects of care and services that showed more positive experiences than others. So this is talking about choice, care and services, employee responsiveness, and communication. And the difference you can see on the screen between long-term care and designated supportive living. And the final 3 dimensions of care are assessed on the resident survey were meals and dining, facility environment, and resident environment. And you'll note here that the lowest average scores were seen for meals and dining dimensions of care. So for the next part of the presentation, I'm going to talk about opportunities and possible actions for improvement that we can see. So from our analysis, the greatest opportunities for improvement in facility-based continuing care based on the experiences reported by residents and family are these listed on the slide: staffing, cleanliness, hygiene, food, and compassion. These are the areas that have the greatest potential to improve overall experience of residents and families. So the HQCA recommends that Alberta Health, continuing care operators, and other continuing care leaders develop strategies in collaboration with residents and families to improve in these areas. And leaders in the facility-based continuing care sector can look specifically to the suggestions from the family respondents to this survey from their own sites, which are detailed in those site reports that were sent out earlier. Several of the HQCA's actions for improvement and associated family members' suggestions do align with the findings from the Alberta Facility-Based Continuing Care Review final report that was prepared by MNP in 2021. So we're going to look at each of these areas for improvement so you can see the scores and some recommendations. So the question around staffing: how often did you feel there were enough nurses and aides at the continuing care home? You'll see the percentage results for responding always. And most of the areas of improvement have also been identified in previous HQCA survey iterations. For example, we've asked similar questions about staffing in multiple survey iterations, and the results have remained low. On this slide, you'll see that 33% of DSL residents and 24% of long-term care residents report feeling that there are always enough nurses and aides at the care home. From the family's perspective, these staffing questions had low results in previous family surveys as well. Enough staff, being able to find staff, and confidence in the staff providing care. And you'll see here that 24% of families in DSL and 16% of families in long-term care feel that there's always enough nurses and aides at their site. These findings align again with the recommendations from the Alberta Facility-Based Continuing Care Review, and the final report's recommendations are noted on the slide regarding staffing, to increase staffing hours and consistency in staffing to improve quality of care, and to resolve labor force issues proactively to maintain needed staffing levels at sites. So some of the suggestions for improving staffing, there was an open-ended area on the survey where family members could write additional comments, and these were taken into consideration when looking at when making these recommendations for actions for improvement. Family members were asked, do you have any suggestions on how care and services at this continuing home could be improved? And using qualitative analysis, we have identified relevant family member comments to give context to the actions and provide suggestions on how to potentially achieve improvements in this area. So these are listed on the slide, and again, we encourage individual site leaders to review the recommendations from family comments on their site level reports for ideas from the families for those sites. And the current work of this sector is working through legislative updates and funding opportunities to aim to address some of these concerns as well. So looking at all levels to work together to improve within the staffing. So I would note things like staffing continuity. This is how staff are assigned to an area within the care home. And by reducing the number of turnover, the literature suggests that there's opportunities for improved care and quality of life. So under cleanliness and hygiene, two of the questions that most impact family experience and the most need of improvement pertain to cleanliness and hygiene, including resident looking and smelling clean, which was question number 19, and the resident's home looking and feeling clean, which was question number 29. So for an example here, less than half the family member respondents said that their loved ones always looked clean and smelled clean. And again, suggestions identified from the family members' comments are listed here. And again, we encourage people to look at their site level reports for specifics to their sites on ways of improving. Related to food, can you get the foods that you like? This question was most impactful to the resident experience, and the need to improve pertain to food. For example, 27% of residents in long-term care said they could always get the food they liked. And again, the FBCC review made recommendations around improving overall quality of meals at the sites, and that's noted on this slide as well. So I'd like to turn our attention to the two new measures that were added to the survey this time, and they're around compassion and quality of life. And this is to recognize that these are key drivers of patient outcomes and patient experience of healthcare and healthcare well-being. And as I said previously, we used the Sinclair Compassion Questionnaire short form. And residents were asked multiple survey questions regarding their relationship with their healthcare providers. And the survey questions were combined and summarized into a single compassion score ranging from 1 to 5, with higher scores indicating greater experience of compassion. So on the slide, you'll see that for long-term care, compassion was rated by the residents at 4 out of 5, and for DSL at 4.1 out of 5. And we also asked about quality of life. And again, this is a new suite of questions added to the survey. And we use the DEMQual tool because current thinking suggests that quality of life is one of the most important aspects of a resident experience. And it also aligns again with the quality or the Alberta facility-based continuing care review. So provincially, long-term care residents' quality of life had an average of 69 out of 100, while in DSL the average score was 71 out of 100. And these results could provide a provincial baseline for resident quality of life in Alberta in continuing care homes. In the final slides of our presentation, I wanted us to look a little deeper at the analysis of these two measures, and just wanted to note that in our analysis, the overall care rating and the DEMQual were related. So that means that as one increased, so did the other. So there's an alignment in how those two are considered together. We're going to start first with the compassion score. And out of the 5 compassion score questions, the ones that were most impactful to resident experience and the most in need of improvement pertain to these questions. And these questions included whether the resident felt that their healthcare providers were attentive and supportive, and whether healthcare providers had a warm presence. And so in each of these areas, there was recommendations for making improvements. So as I indicated, we did some secondary analysis, and this part of the presentation was not reported in the provincial report, so it's new information. And we will be looking at releasing a summary of this on our webpage, and we'll certainly make that broadly available so that you have a written document to refer to. But in the secondary analysis, then, we looked at the questions about quality of life, and then we compared them to other questions that people answered on the survey to make some analysis of what was driving quality of life from this data. So one area that showed a statistical significance in quality of life, meaning was around the cognitive performance scale. So those who were more cognitively well, so they scored higher or lower in their CPS score, had a tendency to have a higher quality of life reporting. But we looked at differences between designated supported living and long-term care and saw no significant difference. Between owner-operator types, and again saw no statistically significant difference between the zones and between metro and urban versus rural areas, and saw no significance correlated to increased quality of life. But we did find that the higher overall care rating did, as I said in the previous slide, indicate a higher quality of life. So if you indicated a high overall care rating, then you had a tendency to also report a higher quality of life. The size of the site was one that we have seen some questions in previous survey analysis. And so we looked at this, and we did find that there was a relationship between site size and quality of life. So the larger the site, the lower quality of life. So it's an inverse relationship, but this was not statistically significant. So hope for those of you who offer services in large sites, you're not doomed to have poor quality of life. There was just a tendency, but it was not statistically significant. We did look at the dimensions of care and compassion and how they related to the survey questions about quality of life. And so in your head or jotting down on a piece of paper, I would like you to consider, out of these dimensions of care and the compassion scale, which ones do you think might have contributed to an increase in quality of life? And I'll just tell you that when I did this, there were some surprises. There were things that I thought would be important to quality of life that didn't actually show to be so when we did the statistical analysis. So we'll just take a pause. But as we're being recorded, I won't pause for a long time. We can chat about it after we finish the recording. So on this slide, you will see that the bolded dimensions of care were the ones that were found to be statistically significant in driving increased quality of life. So these are choice, communication between resident and management, employee responsiveness, the resident environment, and compassion. And on the next slides, I'll go over a little more about the specific questions, which might help you think about if you are putting an action plan together, you might want to consider actions that would address the specific questions that drove these statistical changes. So this graph is, again, just reminding you that quality of life was only asked in the resident survey. And this graph shows that there is, it doesn't start at zero. We were, if you make the graph too long, then it's really hard to see the difference in the scores. But this is a visual picture of what I explained on the previous slide. And so I'll just briefly go over the questions that were specific to driving this quality of life under each of the dimensions. And you can contemplate whether there are actions that you can take that might help with quality of life questions in future surveys. So under choice, the three questions that were driving the increase in quality of life had to do with, can I go to bed when I like? Am I free to come and go as I am able? And are the rules reasonable? Communication with leadership, and I'll tip my hat to say I was really surprised to see this as being one of the drivers of quality of life. And again, for leaders in long-term care, this might be a place where particular action could be implemented to help with improving quality of life. So would you feel comfortable speaking to the people in charge about a problem? And do your problems get taken care of here? So some reflection about some of the ways that leaders interact with the residents. Maybe that practice of leader rounding might address some of this particular part of drivers of quality of life at your site. The questions about employee responsiveness during the weekend. Are employees available to help you if you need it? And do you feel confident that employees know how to do their jobs? Were found to be the questions specifically that drove quality of life. And under resident environment, the questions on the slide about being satisfied with your room. Do you feel safe here? Are your belongings safe? And do you think it's a pleasant place for people to visit? And is the temperature comfortable for you? These were the questions that were found to drive quality of life increases. And compassion. I feel that my healthcare providers are attentive to me. They're supportive when they talk with me. And my healthcare providers see me as a person, not just as a patient. And my healthcare providers have a warm presence. So this data, now that it has been released publicly in our provincial report, will also be loaded onto our public-facing webpage called Focus on Healthcare. You can access Focus on Healthcare by following the link, and I'll ask Ashley or Karis to put that link in the chat for those of you who might want to follow up and see how we are releasing publicly the information about resident and family experiences within this continuing care facility-based area. Focus on Healthcare provides transparency to the healthcare system reporting. And yeah, so that's, we do also have care measures that are taken from the RIE MDS tools as well. So next steps, we are really interested to hear from any of you who may have an improvement story based on your site level reports or this provincial report. And this is an email, generic email that you can contact us at continuingcare@hqca.ca. And we would like to promote good healthcare practices in this area by looking at improvement experiences of the sites for residents and families. And we have a program called Quality Exchange. And so we'd love to follow up with people to see how improvements are happening to drive, or how activities are happening at your site to drive improvements in your area, especially around resident and family experience. So again, this is our generic email. Happy to answer any of your questions specifically.